Hey, welcome back, everybody. Um, this is part two. We left it here where we're going to cover the blood flow. In the previous class, part one, we reviewed the main chambers of the heart: right atrium, right ventricle, left ventricle. We talk about the septum, interventricular septum, the interatrial septum, and the atrioventricular septum, the main blood vessels, superior vena cava, inferior vena cava, aorta, and pulmonary trunk. And we also describe the four valves, right, of the heart. We said that the valves are like doors. They open one way. When they close, they generate a sound, and we have two sounds, so S1 and S2. S1 is when two out of the four valves close, and S2 is when the other two valves close after. S1 is when the heart contracts, so that is systole. And then S2 is generated when the heart is relaxed, that is diastole. Okay, so in order for me to go with the blood flow, I think that it's better if we just have more like a rustic shape or a simple shape of the chambers and the heart structure. So I have these here to help me to go through the structures. So let's first label the major structures. Let's do the four chambers and then the four valves. So this chamber here will be the right atrium. So RA for right atrium. This one should be the right ventricle. What is the name of the valve between the atria and ventricle? Atrioventricular valve, because this is the right atrioventricular valve, or tricuspid valve. So I'll put a TV for tricuspid valve. Now, in the ventricle, there are other valve. Now, this other valve that communicates the ventricle with the pulmonary trunk is called pulmonic or pulmonary valve. It's the same, it's kind of the same thing. Pulmonic or pulmonary valve. Going to describe here, I'm just showing you the right side of the heart, right? We know that this part pumps blood to the lungs. This will represent the superior vena cava. And I want to show you here that these valves, because they are like doors, when they open, this tricuspid valve will open this way, meaning that will allow the blood to go from the right atrium to the right ventricle when the tricuspid valve is open. The pulmonic valve open in the other direction, so it will open this way and will allow the blood to flow from the ventricle towards the pulmonary trunk. Okay, so put here pulmonary valve. All right, just keep that in mind, and let's keep going, labeling the parts. Pulmonic trunk or pulmonary trunk will split in left and right. Okay, because the blood will go towards the lungs. Those are going to be, this one's going to be the left and to the lungs, pulmonary. Blood will move away from the heart, artery. Other one here, right pulmonary artery. All right, that is, and we're gonna represent the lungs, just like two circles over here, right? Okay, keep in mind, I'm just explaining you the blood flow. So I'm gonna show you how the blood circulates from the right side of the heart towards the lungs, then from the lungs towards the left side of the heart, and then from the left side of the heart towards the circulation or towards the aorta. That is the blood flow. However, you need to remember that, or let me clarify this, the way how these chambers contract and relax, because that's the way how the heart pumps the blood, right? When it squeezes, pumps the blood. When it relaxes, allows the chambers to fill with blood again to prepare for the next pump. So keep in mind that all the chambers, they contract, and all the chambers, they relax. So what I'm saying is, and because we have superior chambers called atria, we have systole and we have diastole in the atria, and we have systole and diastole in the ventricles. So the two superior chambers, they contract at the same time and they relax at the same time. The two inferior chambers, ventricles, they contract at the same time and they relax at the same time. Because the ventricles are bigger and more powerful, those are the ones that really generate the function, or those are really the pumps of the heart. But you will see why in just in a minute, why this contraction of the atrium is important. All right, with that in mind, let's let's label some of the parts here in the left side. So we said that this will represent here the left atrium, and here left ventricle, all that area. Between the left atrium and the left ventricle, we have a valve that will open this way. And also the blood always will flow from the superior chambers to the inferior chambers. So meaning this way. That's why they open, the valves open that way. Okay, this valve is called mitral valve. So I'm going to put just NV for mitral valve. Ventricle communicates with another valve. This valve is called the aortic valve. And it's called aortic for the same reason the pulmonic is called pulmonic, because it communicates with the pulmonary trunk. The aortic valve communicates with the aorta. Okay, and they open this way. So the ventricles will pump blood out the semilunar valves. Remember that semilunar valves is the same, is also how we call these pulmonic and aortic. So pulmonic valve, right semilunar valve, aortic valve, left semilunar valve. All right, now that you know that, let's begin with the explanation here, which is not super hard. All right, let me change color here, and we're gonna start with diastole. Okay, so diastole at this point means that the atrium and the ventricle, they're relaxed, they're not contracting. This is the period of time where the chambers are going to prepare for systole and the ventricles will fill with blood, right? So the way how blood gets into the right atria is from the superior vena cava, inferior vena cava. All this blood comes from your tissues, and we know that this blood is low in oxygen, right? During during diastole, right? This tricuspid valve will be open because of two reasons. Because the chamber, the right ventricle, is not contracting, meaning is relaxed. The pressure here is low, and that because the blood is flowing through the atria, the pressure in the atria is greater, is more. So that pressure is what opens this valve, right? And then this blood can start filling the ventricle, right? And this of course is happening very quickly in fractions of seconds. Now, when the ventricles are about 70%, filled with blood, then is when we have the systole of the atria. So I'm just going to mention it here, atrial systole. You will see that that is important, that the atria contracts first and then the ventricles after. So when the atrium contracts in systole, essentially what is happening is that we need that atrial kick, or the atria is squeezing to push more blood faster to complete and to fill the ventricle 100% with blood, right? So at this point, the contractions of the atria allows the completely or allows that all the blood fills the ventricle. All right. And then we have the most important part, the ventricular systole. This is when the ventricles start contracting. So now that the ventricles contract and start squeezing, you can imagine that as the ventricles start reducing the space, the pressure inside the ventricle start going up. Okay, and this pressure, if you think about the tricuspid valve being a door, that pressure is the one that will close the tricuspid valve. So I'll put it here. Now the tricuspid valve will be closed because the pressure is pushing against, and then that is the main function of the tricuspid valve. We don't want the blood goes backwards, because in diastole we just move blood from the atrium towards the ventricle. We want to prevent blood flow, so it makes sense that the tricuspid valve during ventricular systole will close, right? And this is very important. This one will close. Now the blood needs to go somewhere, right? It cannot go there because the door is closed. There's no other way to go. We don't want to go backwards. So what is the other alternative? Is this pulmonic valve. So when the pressure is high enough, right, that will have enough force, enough pressure that will open the pulmonic valve. This is happening during ventricular systole. And once the pulmonary valve opens, then the blood will go towards the pulmonic trunk, right? Then will go towards the pulmonic trunk, and here from the pulmonic trunk, this deoxygenated blood is trying to reach the lungs to get oxygenated, right? So you see what happened here. These two valves in diastole, the tricuspid valve needs to be open to allow blood to go from the right atrium to the ventricle. At the same time, the pulmonic valve needs to be closed to prevent backflow of blood from the pulmonary trunk to the right ventricle. During ventricular systole, when the heart is contracting, the tricuspid valve needs to be closed to prevent backflow, and the pulmonic valve needs to be open to allow the blood to flow towards the area that we actually want, which is the lungs, right? So there the blood goes to the lungs, right? Because the blood is leaving the heart. These are called arteries, right? Pulmonary arteries, right and left. Once the blood gets into the lungs, then let me change the color. Now the blood will be oxygenated and will circulate towards the left side of the heart now. Now from the right lungs, the blood now is going this way. And this, and specifically here in the right side, I just want to clarify this. These pulmonary veins, because the blood flow, they're running behind the blood vessels, and you can see here where they open and drain inside of the left atrium. So we have 4 openings in the left atrium, 2 for the left pulmonary veins, and the other 2 for the right pulmonary veins. And those, even though they transport oxygenated blood, even though they look red, they're still veins because they're dumping blood from other parts, in this case from the lung, into the heart. All right, so the heart just pumps blood, right? What happens after that? Relaxation. So diastole. Diastole in the left side of the heart. That means the chambers needs to they're relaxed and blood can fill the chambers. In this case, we have the mitral valve during diastole. The mitral valve will open because blood is getting inside, and that increases the pressure in the left atrium. And because the left ventricle is relaxed, the pressure is low. That allows this tricuspid valve to open and blood can pass and go to the left ventricle. In the same way, about 70% of blood will fill the ventricles just by that passive. And then we need to have atrial systole, which means just the atria will contract to push the other 20-30% of the blood to complete, to fill the ventricles completely. Now, after that, when the ventricles are 100% filled with blood, then is when we have ventricular, right, systole. Now, we just spend time moving blood this way, right? So it makes sense that at this point, the mitral valve is open, the aortic valve is closed. We never want blood going backwards. So once systole begins, now the pressure generated by the ventricles will start increasing, and that pressure is the one that closes the mitral valve, and it closes the mitral valve so we don't have backflow. Regurgitation is another term, right? We don't want to have that. In some point, the pressure will be high enough that will open the aortic valve, and when that happens, then the blood can flow through the aorta and go to all the parts, different parts in the body. I know it looks messy, but that is what happens. I'm going to show you now the same thing, but how this happens in both at the same time. Okay, for this example, I'm going to focus primarily in the ventricular systole and ventricular diastole, again, because the ventricles are more powerful, there's a more important, right? So when the ventricles are relaxed in diastole, two valves needs to be open. The atrioventricular valves, meaning tricuspid valve and mitral valve, as you can see here in the picture, right? Why? Because during diastole, that is the time when the ventricles are resting and getting ready for the next contraction. So it's obviously here that the ventricles allowing filling from the atria. Okay. So that is what happens in diastole. All right. What else? The pulmonic valve and the aortic valve, it needs to be closed, because if they will be open, then you will have backflow to the heart, and we just pump blood towards them in the previous contraction. So therefore, when the heart contracts, it doesn't make sense that those valves will be open, or you will have, you just pump blood through them. So you don't want backflow, right? So these valves are closed during diastole. The closings of the valves are the ones that generate sounds. Okay, so in this case, these sounds that we can hear in this specific moment in diastole is the sound generated by the closing of the pulmonic and aortic valves. Okay, when the valves open, in the same way how when a door opens, doesn't make a lot of noise, but when you close the door is when they generate sound. So in diastole, we have S2, and this S2 is the one that is generated by closings of the tricuspid, of the pulmonary and aortic valve. The most important one is the ventricular systole, which is contraction, as we can see here. Once the ventricles contract, and they're contracting, as you can see, at the same time, that pressure is the one that closes these valves, which is the tricuspid and the mitral valve. And because you can imagine that the force is greater when the ventricles pump, it's like hitting the door very hard, closing the door very hard, this is what generates the sound number 1, or S1. So S1 is what we hear during systole, and is the sound generated by tremendous force, or basically a pressure, closes the tricuspid and mitral valve um, very hard. So that's why the S1 is harder than S2. And also, when we learn the structures in these valves, you will see that only the tricuspid and mitral valves, they will have a specific structures called the chordae tendineae and the papillary muscles, because these ones are the valves that are under more pressure. Okay, so these valves, and just I want you just to clarify here, tricuspid and mitral valves are the valves that are preventing backflow from the ventricles towards the atria, and therefore, when the ventricles contract, they have to, resist the pressure generated by the ventricle. So these valves need to have enough strength to prevent backflow. Okay. Anyways, when that happens, also at some point, the pulmonic and the aortic valve, they open, allowing the blood flow, in this case from the right lung, from the right ventricle towards the lungs, and from the left ventricle towards uh, the rest of the body. Now that you know that the sounds that we can hear with the stethoscope, so whenever you use the stethoscope, which is this device that you put in your ears, I'm pretty sure you're familiar with them. Um, these are the things that we're going to use to listen to the heart and the sounds of the heart, right? These ones in these pictures, you can see different points that we use normally to evaluate specific valves or specific areas where you can hear the valves easily or better. In this case, if you put the stethoscope in the second intercostal space in the left side of the sternum, so right sternal in this case, that's the place where you have the aortic valve, where you can hear it better. And in the opposite side, in the left side, pulmonic valve, here tricuspid, and then here mitral valve. Anyways, so S1 and S2. Remember, S1 is the louder, so and is the louder, occurs in systole. And if occurs in systole, that means that the valves that are closed in systole are the tricuspid valve and the mitral valve. Those are the valves that had extra structures to provide resistance, because they have to support, they have to uh, um, be able to maintain and prevent the blood flow from the ventricles to the atria. So they need that extra structures to, because they are the ones that are under a lot of stress, a lot of pressure. When the heart is relaxed, right, we learned that the generates a second sound, which is not super loud, and this second sound is the result of the closing. So this is in diastole. Diastole, the valves that will be closed in this case are going to be the other ones: pulmonary valve or pulmonic valve, and the aortic valve, right? Because it's diastole, that is the time when the ventricles are going to fill with blood. So it makes sense that during diastole, the tricuspid and mitral valves, they will open. And because we just pump blood through the pulmonic and aortic valve, when the heart is relaxed, we don't want blood to go backwards. This is the time when the pulmonic and the aortic valve will close. And the closing of these two valves are the ones that generate the S2. Again, these two valves, they usually close and open synchronically. So most of the time we only hear S1 and S2. The sounds that we can hear with the stethoscope, but especially when we use the stethoscope to listen to the blood pressure and the sounds for the heart is called the Korokov sounds. So the Korokov sounds are these ones that are the ones that we can hear using the stethoscope. Most importantly here, when we check blood pressure, we're going to see that. I'm going to talk about that later when we review cardiovascular system, when you review the blood vessels, arteries. Let's see the S sound in more detail. Remember, S sound is the louder, is the sound that is described as a loop. Remember that S sound, or I mean the sound 1 or S1 happens when the ventricles contract, so that means systole. And recall that during systole, the valves that close are going to be the tricuspid valve and the mitral valve. I want you to also look at this graph and notice that we have 0, 20, 40, 60 millimeters of mercury. That is pressure. So pressure is this force that is the pressure in the chambers. The difference between pressures in the chambers is the force that close and open valves, right? So also, if you pay attention with the colors of these lines in the graph, particularly here, I want you to look at the green one. This is going to be the pressure inside of the ventricles, okay? So let's see what happens first. So during systole, we know that the ventricles start squeezing and the pressure inside here is high, very quickly. It goes so high and very high in such a short period of time. You can see how this is represented by the graph, how the pressure in the ventricle goes extremely high, right? That is the pressure that closes the AV valves, meaning atrioventricular valve, which I have here in red. That is what causes the S1. That is the equivalent for you to slamming the door very hard in a room. That's what generates the S1. At the same time, as the pressure goes up, notice that in order for the valves, the semilunar valves, aortic and pulmonic valve, in order for them to be open, you need to reach a ventricular pressure that about 80, okay? So once the ventricles reach that 80 millimeters of pressure, that is the pressure that is enough to open the pulmonic and the aortic valve, and then the blood can flow, as we can see here in the picture. So what that means is that the ventricles need to generate at least 80 millimeters of mercury in order to open the pulmonic and aortic valve. And then after that, as this happening, of course, in fractions of seconds, then the blood flow can occur, and that at this point is the end of systole. Okay, let's look what happened then when we start diastole. The S2 sound is described as the dupe and is the second sound of the heart, occurs during diastole, and we know that is when the pulmonic and aortic valve closed. Now, we know that S1 is louder because is when the ventricles contract, the pressure is extremely high very quickly. Now, these valves are going to close. We left it here. This is the end of systole. And then as the ventricles start relaxing, now the pressure inside the ventricles start dropping, right? Because now the walls are relaxed, pressure start dropping. And if you're more visual, this is what just happened. During systole, the blood went this way. That's systole. And then in diastole, remember the blood now is not being pushed. The blood will go kind of backwards a little bit, right? But at the same time, that movement of blood going backwards, that's what closes the valves. And also, of course, the pressure inside the ventricle now is not is going lower and lower and lower, and those valves will close when you reach a specific pressure, right? In this case, when the ventricular pressure drops, to about 90, right? And those numbers, you don't have to memorize them. That is the pressure that will allow the valves to close. And that is the sound. And again, if you read here, semilunar valves close, that is your pulmonic and aortic valve. That is the one that will close to prevent backflow, right? At the same time, because we know the pressure in diastole is reduced, that allows the tricuspid and mitral valve to open to allow the blood to go back and start filling the ventricles. So the cycle will repeat after. There are other abnormal sounds. This is just something that you need just to read about it. I don't think that you're going to have a lot of questions in your exams about this, but it's important to know. First, that the normal sounds is S1, S2. There are other extra sounds called S3 and S4. These are called the gallop because when you hear the sound on the stethoscope, that sounds like a gallop. Normally, the heart will sound like loop, doop, loop, doop, loop, doop. And then when you have uh, an extra sound, will sound like, so it's going to be like a gallop sound, right? S3 is a sound that takes place when you have blood entering into the ventricle very quickly and very hard, right? It's blood sloshing back and forth into the ventricle. Normally, this is something you see in hypertension, for example, but again, it's not super important. S4 at this point for you. S4 is a sound that is the result of a contraction of the atria pushing against a hard and stiff ventricle. This is also another abnormal sound. S3 and S4 are abnormal. Now, the term murmur is something you're gonna hear more often. A murmur could be uh, most of the time murmur is pathologic, right? In some circumstances, might be physiologic. The point here is a murmur, if we describe the valves, is when one of the valves let some blood leak, uh, or the valve do not open enough, creating a turbulent blood flow. What that means is if you have a valve that is supposed to be open and it doesn't open completely, that will generate a turbulence and that will generate a sound. Or the other thing could happen is that a valve that's supposed to be closed, let's say that it doesn't close, or if it closes deficiently, allow some blood to go backwards. There's going to be turbulence of blood that will generate also a murmur. Now, just know at this point, murmur is just a turbulent flow of blood, and that's most of the time associated with problems with one of those valves. But that's all what you need to know. Right now. Let's review very quickly the pulmonary circuit and the systemic circuit, which at this point I'm confident you remember what are those. Pulmonary circuit is the blood flow that happens between the heart and the lungs, and the systemic is between the heart and the rest of the body. So recall that the right side of the heart is the part of the heart that receives deoxygenated blood, and that is represented in blue. And everything starts here from the tissues, right? Remember, the tissues are the ones that suck all the oxygen. And then the oxygen becomes deoxygenated and through veins is transported back to the heart. Specifically, or eventually, the blood will reach the superior and inferior vena cava. So the pulmonary circuit, again, is between the heart and the lungs. So we're not yet there. We're going to start with the right atrium, letting blood pass through the tricuspid valve, and then here's when the pulmonary circuit begins with the right ventricle. So the right ventricle in diastole will be relaxed, blood will start filling the chamber, and then eventually during systole contraction, the blood will be pumped towards the pulmonary trunk, you know, through the pulmonic valve. So the pulmonic valve will open during systole, the tricuspid valve will close, that will generate the S1. Then the blood from the pulmonary trunk will go to the right and left pulmonary arteries, then from the pulmonary arteries towards the lungs. Once the blood gets into the lungs, into the smallest capillaries, this is when the gas exchange occur, and then the blood, because we're in the lungs, get oxygenated. Okay, so now the blood is oxygenated, and the blood now is going to return to the left side of the heart. The blood goes from the lungs through the pulmonary veins and will reach the heart, specifically the left atrium. From the left atrium, then go to the left ventricle. So at this point, you see this from the right ventricle to the left atrium. That is what we call the pulmonary circuit. The systemic circuit begins with blood in the left ventricle. During diastole, the ventricle is preparing for contraction, and systole, the blood gets pumped to the aorta through the aortic valve. And then from the aorta will get spread to the entire body, tissues, and the cycle repeats. Because the systemic circuit is more large, of course, the left ventricle needs to reach more pressure and more force. That's the reason why the ventricle in the left side is the muscle is thicker, because what we mentioned before, it requires more pressure to pump and to make that blood flow so you can reach all the tissues in your body. We mentioned that the heart is this organ that has three contradictions. We said that we mentioned the first two. Apex in the heart is backwards, is in the bottom instead of in the top. We also, the second contradiction that we said is that within the heart, there are arteries that are red, there are blue, and there are veins that are red, right? That's in the rest of the body. Blue is a vein, red is an artery, right? But in the heart, you see they can be the opposite. So you don't be careful in your exams with that. Now, the third contradiction, or the third thing that happens in the heart that is different than the rest of the body, is that the way how your tissues receive blood, or in which specific phase of the cardiac cycle the tissues receive blood, is during systole. And of course, it makes sense, right? Because in systole is when the heart contracts, is when the blood gets pumped through the aorta, and the blood will move towards the tissue. So the tissues receive blood during systole. Now, the heart itself do not receive blood during systole. Instead, the heart itself receives blood during diastole. And this is the only organ that receives blood during diastole instead of systole. I'm going to show you here a representation of that. And of course, just keep in mind that all your tissues need blood, all your tissues need nutrients, and that includes the heart itself. And it's important to recognize that even though there's a lot of blood inside of the chambers of the heart, the muscle that is the contractile and the functional part of the heart cannot use the oxygen contained in the chambers. Instead, you need to have arteries that supply blood directly to the muscles. And those arteries are these ones that I have here in red. Okay? This is the aorta. So the aorta, as now in A&P2, you need to know specific portions. So the very first portion of the aorta, the beginning of the aorta, is what we call the ascending aorta. Okay? And the ascending aorta is the one that has two branches. These little branches that you can see come out of that specific portion. The left coronary artery and the right coronary artery. Now, just imagine that when the heart contracts, so meaning in systole. Let me change the color here. And we have the aortic valve. So think about the aortic valve that in systole will open this way, okay, allowing blood to go this way, so it can be and go to the rest of the circulation that is happening in systole. And the way that I like to think about this is these valves. It's not that happens like that, but at least visually help me to remember that. During systole, there's a blockage here, so the coronary arteries are not receiving blood, right? The rest of the body is receiving blood. Then after that, we have diastole. So the heart is relaxed. Now the blood is not going that way, but actually it's kind of returning this way. And that is what closes the aortic valve. And now during relaxation, during diastole, that is the time when this blood can go to the coronary arteries and provide blood to the heart itself. That's what that means when we say that the heart receive blood supply during diastole, or when the muscle is relaxed. We know that your tissues, your organs receive blood through arteries, and they return blood through veins. So the same thing happens with the heart. The good thing is that you don't have to memorize all the veins, okay, cardinal veins or marginal veins or etc. of the heart. You just need to know basically two: the coronary arteries, right and left, and then the main vein that drains blood from the muscle is called the coronary sinus. Okay, so coronary sinus. So the key word here is coronary, right? And specifically, coronary sinuses or sinus is the largest vein that drains all the blood from the heart, and it dumps the blood inside of the right atrium. And that is what is important, because once again, the right atrium receives blood, from three major veins. One of them is the coronary sinus, which now we know that it drains blood from the heart. The other one is the superior vena cava, and the third one is the inferior vena cava. When we learn the parts and the structures inside of the heart, we're going to see that there are three openings in the right atrium, and these are for those. So one opening is for the superior, inferior vena cava, and the other opening is for the coronary sinus. And in the picture, you can see this here, right? This is the superior vena cava. This is the inferior vena cava over here. And then we have here the right ventricle, and this is the space where they dump the blood inside. And you will see that better in a different view. What are the disorders related to the coronary artery? As we just learned, the coronary arteries are the arteries that supply blood to the heart itself. And the main thing that affect if there's something that affect the circulation, the blood flow to the coronary arteries, that means that will affect the heart itself. The main reason why a coronary artery will get damaged is when you have uncontrolled blood pressure, right? What we call hypertension. Remember that what is blood pressure? Blood pressure, which is one of the vital signs, is measured by a blood pressure cuff, right? We put it in the arm usually. What we're measuring is the pressure in the arteries. And what we're measuring is how much pressure are inside of the arterial walls. So your arteries are the ones who are basically taking all the pressure generated by the heart when the heart is contracting and when the heart is relaxed. And as we mentioned several times, their normal values, normal parameters of temperature, pH, etc., to keep your organs working properly. So when in this case, the optimal blood pressure to keep your arteries healthy is between 20 and 80. They're designed to work under those conditions. Eventually, if your blood pressure is high and it keeps high, 160 over 90, 140 over 70 for a long period of time, your arteries are not designed to, to maintain that pressure, and then it's when you start seeing damages. So hypertension is one of the things. The other things like obesity, smoking, people with diabetes, alcohol, hyperlipidemia, all this stuff, all these risk factor, cholesterol. When we think about cholesterol, I'm gonna mention this just because it's pretty often. There are two types of cholesterol, what we call the LDL, or low density lipoproteins. Those are the ones that we call bad cholesterol, because this is the cholesterol that accumulates in the walls of the arteries. And then the HDL is what we call the good cholesterol, high density lipoproteins. Those do not accumulate in the arteries. And then when you have all this accumulation of substances, fatty materials, including cholesterol, white blood cells, collagen, blah, 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 smooth cells, that forms a plaque. And that is the plaque is the one that occludes the artery. So what we have here, right, is an angiogram. Basically, is an exam where we inject a dye so we can see through the arteries, and then we take a picture. And you can see here that there's this narrowing in one of the left coronary arteries, right? That narrowing, if we draw here, that means that you have a blood vessel. It's supposed to be like this. And you have a plaque that is growing, a plaque that is growing and is growing and is growing and is blockading and obstructing the blood flow. So most of the time, you will be asymptomatic, or the patient will be asymptomatic, until this plaque reach or covers about 70% of the lumen. So when the plaque covers 70% or more, that means that the patient will have less blood delivered into the heart. And whenever the heart needs to pump faster, or whenever if a patient do exercise or start walking, the heart will start suffering, will have not enough blood supply, and that's when the patient start developing chest pain, right? So pretty common. Also, this plaque here, atherosclerosis, is something that eventually, if the blood pressure keeps high, that can rupture and generates a blood flow that can blockade completely the blood supply and can generate what we call an MI, or myocardial infarction. What is myocardial infarction? It's the formal term that we use when somebody has a heart attack, right? So we just described that normally a healthy coronary artery will allow the blood flow to the tissues, in this case to the muscles of the heart. When you develop a blockade, right, that reduce the blood flow, or that completely reduce the blood flow, then is when you have ischemia. Ischemia refers to the term when you don't receive blood and nutrients. And hypoxia is specifically oxygen. Ischemia is worse because not just oxygen, but just no blood, okay? No nutrients, no water, nothing. Ischemia is worse than hypoxia. Because why is worse? Because in hypoxia, at least, you have sugar and your tissues are able to generate ATP without oxygen. Eventually, that's bad. But the point here is that in this case, ischemia is what causes the muscle to die eventually. And remember, the muscle tissue cannot regenerate. So when somebody has a heart attack, what you're going to have instead, after, if the person survives, is a scar tissue in the heart that will not be able to contract. And of course, when the heart works as a pump, as a whole unit, when you have regions of the heart that are not contracting, that can lead to arrhythmias. And the first few hours after a heart attack, what kills people is arrhythmias that develop because the dead tissue is not contracting, and then that disturb the rhythmicity on in the heart. I said that the heart and the tissue that forms the heart, the myocardium, is not able to regenerate. That doesn't mean that the heart cannot grow. Okay, so what that means is this term hypertrophy was a term that we learned in the past in A&P1, describing that your tissues, when they say that you have, I'm just gonna make three to make it quickly. You have this, and that is an organ, a tissue, right? You can grow a tissue in two different ways. You can grow a tissue if you make more cells. That's what we call hyperplasia. So now the tissue is bigger. Or you can grow a tissue, but by making the cells that you already have bigger, right? So you have still the same amount, but each individual cell become larger. That is what we call hypertrophy. So the heart is able to grow by hypertrophy. Now, we have pathologic hypertrophy, meaning the heart grows and becomes thicker because abnormal conditions, or we have physiologic hypertrophy, which is the typical enlargement of the heart in people who do a lot of exercise, athletes, and they have thicker muscles, and their heart is eventually what it's telling you is that I told you before the normal heart rate is between 60 and 100. People, right, with a normal heart rate, people who are athletes and run and they do a lot of exercise and they have physiological hypertrophy, the heart becomes so efficient pumping blood that you will see that those patients sometimes they have maybe a heart rate of 50, and that doesn't mean that something is wrong with them. Something is happening in their heart. It's just that the heart is so efficient that it just needs to pump. It pumps better than others, so the heart rate with 50 will be okay. Um, and that what happens normally when you have aerobic exercise like running or swimming, you develop this physiologic hypertrophy. What will be an example of pathologic hypertrophy? Is a type of hypertrophy that the heart develops because of blood pressure, because of high blood pressure. Right, we're going to complete this part two by reviewing specific structures, internal structures that you can see in the chambers and the parts of the heart. And so this is additionally to what we cover. This is important for your lab, be able to recognize this one. So first, let's look at the right atrium. So what we have here is a picture of a model, right atrium. We open the heart so we can see the internal parts of the atrium. And if this is the right atrium, that means this blood vessel here is the superior vena cava, of course. This one here, which blood vessel is that? Is the aorta, okay? And this one here is the pulmonary trunk. You might say, I don't know how you do that. How do you do that? Look for structures that are easy to identify first. For example, the right atrium is pretty easy. And all this space here should be the right ventricle. So remember that the right ventricle is the one that pumps blood in this direction, right? So therefore, that must be the pulmonary trunk. What is this thing here? Well, that is the left side. That is the left atrium. And barely we can see here the left ventricle that has not opened. I'll show you that later. If that is the pulmonary trunk, and if this is the right ventricle, which valve do you think is this? If you say pulmonary valve, you got it right. Also, uh, this blood vessel here that runs besides the superior vena cava, that is the aorta. And we just know that this first branch of the aorta is the coronary artery. That is the one that goes and provides blood supply to the heart, right? So that is the right pulmonary artery. We can see the left pulmonary artery running here. We cannot see where it connects because we have the pulmonary trunk blockading. But if we remove the pulmonary trunk, as I showed you before, you will see that the left pulmonary artery runs, or is a branch of the ascending aorta. All right, what else? These three openings that we mentioned before, those are the parts that basically dump blood or drain blood into the right atrium. The opening for the inferior vena cava, opening for the superior vena cava, and this other blue is the opening for the coronary sinus, which I told you that is the most important vein of the heart, right? What else is important to recognize here? Remember that there's a scar tissue that closes once you are born. You remember what was the name of that? When you're a fetus, it needs to be open to bypass the lungs. That was called the foramen ovalis. So the scar tissue, what remains after, right, is called the fossa ovalis. Okay, so foramen ovale is in the fetus, the fossa ovalis is in an adult. Those are all the structures you can find in the right atrium. Only in the atrioventricular valves you're going to find chordae tendineae, and that sounds all funny because it's Latin, and the papillary muscles. So what is the chordae tendineae? Chordae means like a cord, and tendineae comes from tendon. So sometimes they're described as the strings or the heartstrings, right? Because if you look at the picture here, this is a real picture dissection of the heart. These white little things are the chordae tendineae. Because they're a string, they have two ends. One end attaches to the valve, and the other end of the string attaches to the muscle called papillary muscles. Now, notice that the papillary muscles and the trabecula carneae, which is the ridges of the cardiac muscle, they look very similar. So how are you going to distinguish the difference between them in an exam? Only the papillary muscles are, or if you can find the strings of the heart, the chordae tendineae, which should be easy, only those attached to the papillary muscles. So these ones that do not have chordae tendineae, they must be the trabecula carneae. Well, if you look at the strings and if they attach to something here, that must be the papillary muscle. Now in the model, I'm going to show you why only the atrioventricular valves contain chordae tendineae and papillary muscle. And that's because I mentioned before, these ones are the ones that are under a lot of stress from the ventricle, and those extra structures are the ones that prevent backflow of blood, of course, from the ventricles towards the atria. Let's look at the left side of the heart, starting here with the left atrium. Notice that there are four openings. Each opening, this one that go more towards the left, and this one that comes from the right, those are the pulmonary veins. Those are the openings for the right pulmonary veins, and these ones here are the openings for the left pulmonary veins. Don't get in the heart if it's, don't go with colors, as I mentioned before. I keep saying that over and over again because that's where students will lose points in exams. Also, we can see here, so this chamber here is the left atrium. And now I'm going to show you the left ventricle next, which is pretty much the same. These are how the valves look in the model, okay? These ones are the chordae tendineae. So remember, the chordae tendineae, they have two ends. One end Attached to the valve itself, this one is the mitral valve or bicuspid valve or left atrioventricular valve between the left atrium and the left ventricle. Chordae tendineae, and if you want to find the papillary muscles, look where the chordae tendineae attach. In this case, the muscle where they attach, that is the papillary muscle. If you can do that, you will never get that wrong in the exams. So you will not confuse papillary muscles versus trabecula carne, which are the ridges of the ventricles. By the way, trabecula carne can only be, and the papillaries can only be found in the ventricles. Now, what else? Which other valve do we have? Look at there, barely, I don't know if you can see it, the arrow is pointing to the semilunar valve. In this case, the left semilunar valve, or what is the other name? Aortic valve. All right. Now, without looking, during diastole, which of these two valves needs to be closed? Once again, in diastole, which valve needs to be closed? Is it the aortic or is it the tricuspid? I mean the mitral valve. Pause the video and let me just to think which valve needs to be closed in diastole. All right, if you say aortic is correct. The aortic needs to be closed in diastole because during systole, that's the way how you pump blood, right? So in diastole, you don't want to have backflow. So it's obvious that during diastole, the aortic valve will close. That will generate the S2 sound. And at the same time, during diastole, the mitral valve will be open. So the mitral valve will be open to allow blood to pass and fill the ventricle. During systole, the opposite happens. During systole, the heart squeezes, the ventricle will squeeze and will pass blood. During diastole, we just move blood from the atrium to the ventricle. The mitral valve needs to be closed. Right? And the aortic valve needs to open. The closer, when the mitral valve closes, that generates the S1 sound.